For the last 5 weeks since we began Step 1, and in the 2 weeks since we entered Step 2, we've been able to enjoy life in a different way than we have had over the past 2 years. I know this shift has been easier for some than others, and I know that many have cautiously been watching to see what impact, if any, these changes may have had. So I'm pleased to report that it does not appear that easing measures has caused an uptick in numbers since we entered Step 1 on February the 8th. We continue to see a decline or plateau in both our lagging and leading indicators. Overall, since Step 1 began, it has dropped by 7%. There has also been a continuing steady decline in the most important lagging indicator, hospitalizations. Today, hospitalizations are down to 989, including 70 in ICU. Both those figures are down by around 40% from when we began easing measures. As we shift out of crisis mode and move toward an endemic response, we can make adjustments to the way we operate, which is why I would like to announce 2 changes that we are making to our COVID-19 response. First, we are modifying our public data reporting. Beginning next week, we'll join other provinces, such as Saskatchewan, in reducing case and outbreak reporting to once per week. Data for the previous 7 days will be available each Wednesday. Now that rapid test kits are broadly available to all Albertans and employers scaled down mandatory testing programs, we're winding down the employer and service provider program as planned. This program has been focused on regular asymptomatic testing at work sites, which is no longer required in the majority of settings. As of April 1st, the program will only be available to employers and service providers who care for vulnerable populations.